everybody. I'm so happy to share some of my thoughts on this 1st of July 2020 on the occasion of the Doctor's Day. Thanks very much for all your wishes. Why did I choose medicine first of all? My parents were doctors. So it was a natural choice, like I didn't have any other choice. It was not thrust on me. My parents did not thrust it on me. They did not say that I have to become a doctor only, but I cannot find a reason. It was natural. So when I was in school, I decided I'll take up biology and study, and then went into medicine. Now after I finished my MBBS, I went into anatomy. I specialized in anatomy. I wanted to do general surgery. So for some time I was a senior resident in general surgery. And after that, after having been in general surgery for some time, I wanted to do some research, especially in genetics and related areas. And for that I went into anatomy. And anatomy departments, I've served in several anatomy departments. I've worked in Stanley Medical College, I worked in Kanyakumari Medical College, I worked in Madurai Medical College, and then I worked in Madras Medical College, my own alma mater where I studied. And all these places I've had a very wonderful department where we all used to move like family. The first thing that a medical student does is to come into anatomy and learn anatomy. Of course, you might have seen in the movies and all that, it's slightly scary, they say, because you deal with dead bodies and all that. But then, as you travel along, we get used to it. We get used to it, we know how to handle, and we know what precautions to take and such things. So, we make a scientific study of it. So that way it's something nice. And anatomy is the basis. Anatomy is the basis for all medical sciences. Without anatomy, nobody can learn anything else. You want to do a surgery, you must know where your structures are. And you want to treat a patient, you must know which particular part of the body is affected. So anatomy is the basic for medicine. Not only for medicine, I'll tell you there's another interesting thing about anatomy. Things like which you think are unrelated. Garment factory. There are several books, which are intended to be studied by people who make garments. So when you make a particular dress, you must know how a person's structure is. Only then you can make a kind of a dress which will look nice and appealing. So for garment designers, they should know human anatomy. The general basics, not necessarily the intricate details. But then if you want to sit in a chair, right, ergonomic chair, so you must know how your spine is, what is the normal anatomy of the spine, and will the chair give comfort to that normal anatomy? Will it keep the spine in the normal position? So whatever, if a manufacturer of a chair should know normal anatomy, so you can go on. Somebody who makes shoes should know how the feet will be, the human feet, the average human feet, how will it be? So anatomy has its implications all over. Whatever we do in humanity, whatever we do in human civilization has a lot of importance. So anatomy has a bearing in all these things. That way, I am very happy to have been an anatomist for so many years. I've taught at least about 35 batches of MBBS students. So I'm really proud to say that I'm an anatomist. And we are in the COVID time. Yes, my dear, this is a pandemic which has hit several countries. Almost every country is affected. Pandemic is one. The disease spreads across the globe. So what would I want to tell you all, young children? Stay safe. Please adapt yourself to follow the habits which we need to follow. These are all new. Wearing a mask is new. Physical distancing is new. And not touching the face or the eyes. Maintaining hand hygiene. Now these are all things which we need to follow for probably the next year or so. 6 months, 8 months or a year. I would even say for the next 1 year we will have to follow all this. Yes, I'm just removing the mask and speaking so that no one else is here and it's easy for me to speak. But then if someone else had been here, I would have definitely donned my mask. So make these your habits. Please follow the precautions, please follow the guidelines and stay safe. And there's some question on vitamin D, the relationship between vitamin D and COVID-19. See, COVID-19 is a very new disease. The virus is also new. We have come to know of this virus and the disease only from 2019 December, just about 6 months. So several research studies are going on and we do not know much about it. There are several things coming. I would only say, as young girls, I would request you to maintain your health well, eat proper food, eat good food, don't ignore your eating, do some exercises, keep healthy. If you're tuned to yoga and pranayama and things like that, do follow them, do continue them, and eat balanced food, have some vegetables, fruits, and also immune boosters like gooseberry, tomatoes, lime, vitamin C they give, and have a lot of ventilation where you stay. These are all immune boosters, and these immune boosters can help us combat COVID. If your immunity is well, the innate immunity is good, then you can fight well. That is it. So you don't even have to get the disease. You don't get the disease if your immunity is good. And what message would I want to share with you as a doctor today? I'm happy and feel very responsible to be a doctor. I'm not saying that only medicine is the profession available for anyone, but then I am happy that I've come into the world where I would be able to help a lot of people. So I'm happy to be a doctor, and today being Doctor's Day, which is the birthday of Dr. B.C. Roy, I look back. I've read about Dr. B.C. Roy, a man who had a lot of social conscience and who did many things to the society. I would only want to be as responsible as he was and do my little mite to the society. Thank you and all the best. Stay safe, be safe.